All right, here we go. Now up to chapter 5, medical terminology. Medical words sound big and confusing and intimidating. What do you do with something that's big and intimidating? You break it down into little pieces so you can hack it up. Zuntate. All right. Thought for the day. Safety is always going to come first. Machine's not safe and you become injured, the minimum you've done is doubled the number of patients. Don't do that. Any questions? All right. We're going to go over why we need to understand medical terminology. We're going to go down how to break down every medical term into 4 different components so we can understand it. Then we're going to go over the directional and basic terms of anatomy. Excuse me while I pound some caffeine to stay awake. So every medical term has 4 different pieces to it. You got the root word, which is the foundation. You got the prefix, which comes before the root. The suffix, which comes after the root. And then combining vowels, which you have to purchase from Vanna. Questions? Wheel of Fortune. Unless you probably don't even know who Vanna is. Probably don't even know who Wheel of Fortune is.
I haven't watched that.
So here's some examples of root words that you will have to know to pass the test. If you cannot understand medical terminology or your vocabulary words, it's impossible to understand the questions and answers on a test and choose the best answer. So here's some examples of root words. Cardi means heart. Hepa means liver. Nephra means kidney. And thoracic means chest. These are examples of root words. There's many more than these. These are just some of the most common ones that you. Any questions? Now here's some examples of prefixes. Hyper means excessive, over, fast, too much. Hypo means not enough, below, weak, not enough. Tachy means rapid, fast. And Brady means slow. So if somebody has bradycardia, it would be what?
Slow heart rate.
Exactly. See, once you break it down, it's not so bad.
So right.
Tachycardia would be fast heart rate. All right. Here's some suffixes. Ectomy means surgically removed. The tonsillectomy would be tonsils. Cardiectomy would be the cardiectomy.
Oh, the removal of a heart.
Removal of the heart.
Okay.
That's why you never hear of it, because you wouldn't survive.
Right.
Itis is inflammation. So what would hepatitis mean?
Liver.
Exactly. Coma is a tumor. Pathy is a disease. So cardiopathy would mean heart disease. See, all these big bad words aren't so bad when you break them down.
Well,
Make them
some of the
small.
meanings could be bad.
That's right, but the actual intimidating word when you see it on a test
My bad. All right.
isn't so bad. All right, directional terms. Right is the patient's right. So when you're looking at them, it's their right, not your right. Make sense? Left is the patient's left. Lateral means away from the body. medial or away from the midline of the body. Medial means towards the midline of the body. Proximal is on your extremities, is away from the thorax. Distal is towards the thorax. Example, the wrist is distal to the elbow. The elbow is proximal to the wrist. Makes sense? Superficial means just on the super surface. Deep means deep penetration. Questions? Ventral is the belly side. Dorsal is the back side. Think of a shark, has the big dorsal fin on its back side. Anterior is the front of the body. Posterior is the rear. Any questions? No questions? Okay, everybody can go home. We're done for today. Yeah.
I read this chapter by myself last night and struggled.
Much easier when I explain it though, right?
No, for sure.
I'm just that good.
Okay.
So, Palmer, think palm of your hands. Palmer. Plantar is the bottom foot. Think you get the plant. Flexations to flex. Extensions to extend. Adduction is moving towards the body. So thinking of adding to your body. Abduction is moving away from your body. Any questions? No questions. There's some pictures in case I didn't explain it. I did it in full animation. This is just still. All right. Anatomic positions. Prone is actually face down. She's not truly prone. Supine is lying on your back, face up. Any questions? Shock position is supine with the foots elevated. Trendelenburg is a semi-sitting position. So if your head's just up slightly, we call, I'm sorry, Trendelenburg is your head down. Fowler's is a semi-sitting position. Trendelenburg is head down, feet up. Fowler's, which isn't listed here, but shows the guy there in the bottom right. There's three Fowler's position. Low Fowler's, that's the head slightly elevated. Semi-Fowler's, which is 45-degree angle, and then high Fowler's, which is closer to 90 degrees. Any questions about shock, Trendelenburg, and Fowler's? Most of the patients that you'll find in Fowler's position are just above Lower Falls and McLeod. Any questions?
Why'd you stare at me?
I don't know.
I know I struggled with the test, but you don't have to sit me down.
That's the end. All right. Let's go over some questions. We have time. All right. Which of the following components of a medical term conveys its essential meaning? Yeah, it says it sees the correct answer. So yeah.
I was kind of waiting for
How did you just know that?
I
I think I was supposed to go all the way back to here. All right. Prefix can indicate what?
Okay.
Anybody disagree? Look at that.
like cyanosis.
All right, the plural form of the word bronchus is D.
I'm saying
Nope.
D.
C.
D.
It's D.
D is in dog.
Yes.
Not a dog. It's bronchi.
Okay.
All right. Next one. The lungs are superior to the bladder indicates the lungs are closer to the.
C.
Oh, look at you guys. That was awful confident. All right, movement of the arm towards the midline would be. Very good. Everybody agree? Nobody wants to go out on a limb, challenge the common thought. You're all sheep, huh? Well, you're correct, sheep. All right, body part that lies closer to the midline when compared to another is considered to be.
A.
Ow. You guys ready? If you sure you don't want to take the exam tonight?
No.
I mean,
Sounds like you're ready.
I was ready to take it.
I was too. Oh. Send him to a different room. He can do it.
You guys are going to be easy to fool since you don't read your syllabus.
I will do it.
That's oh, all right, bro.
All right, which is the belly side? What?
D. Somebody didn't get to read it yet.
Wow.
I'm like, how's this
Wait till we start playing Jeopardy. You're going to be like smoking people.
I'll throw a podcast.
All right. This is used to identify. Oh, Jesus Christ. You place a patient in a semi-Fowler position. This means they're at what? All right, you guys got all this. We're not going to waste time.
I like
Yeah, but then you can go be ahead. Then you get to go home earlier later on in the class when
No,
you're
yeah.
ahead.
Yeah, you're right.
Of course, I'm right. I'm the instructor.
Oh my god.
he gets you down, bro.
I'll just shut up. I'm done.
All right, there's the human body. If you took all the skin off. Thoughts for the day. Understanding the past is critically important. Making the best choices on how and where to move forward. Understanding the past is important, but living in the past prevents you from growing and prevents you from obtaining opportunities. Remember the past, learn from the past, but always move forward. You're going to make mistakes and you're going to make bad choices because all of you are human beings. However, the actions and choices you make after the mistake is what makes you or breaks you. Understanding the past is critically important, but dwelling in it, not. Make better choices and move forward. Learn from it. Any questions? All right, skeletal system. Gives your body form. Also the most popular person at a Halloween party. Yes. Protects the vital organs. And most people have 206 bones. Not all, but most. Acts as a framework for attachment of muscles. Of course, gives you motion. Well, the muscles using the bones as resistance gives you motion. Any questions?
Doesn't it only also reproduce the red blood cells too?
It does inside the marrow.
Yeah.
The bone marrow. There's your skull in living color. It's not actually that color, but we colored it up for you to make it easier to identify. You should be familiar with those pieces. Any questions about the skull? So that's a cadaver that got run through a bandsaw. It's pretty cool though. Shows you where the brain is, the brain stem, spinal cord, cervical vertebrae. Don't have a whole lot of room there for the spinal cord, do you? So if it gets crushed or swells, bad things happen. The neck, carotid arteries are important to know. Cricoid cartilage is important to know. There are going to be test questions on that called the select maneuver where you push against it. Collapse the esophagus, so when you're BVMing people, you don't fill the stomach up with air and have them puke all over you. Trachea is important to know. Any questions? All right, spinal column. Like 31 vertebrae. Each one has their own unique name. You have to know each one of their own unique name and be able to identify them. What's the big off for? I'll bet you I can teach you the names, the individual unique names for every one of these vertebrae. By the end of the night, you will know every one of them. You ready?
Yeah.
We're going to learn them right now.
Right now?
7 cervical vertebrae. The first one, right at the base of your skull, that one's called C1.
Oh.
One right below it, it's called
Son.
C2.
Bro.
The next one down is C3. It goes all the way down to C7. Then we start the thoracic vertebrae. The first thoracic vertebrae,
One?
T1. Second one's called,
T2?
third one's called,
T3?
it goes all the way down to T12. Then we got our lumbar. First one's called L1. Next one's called
L2?
L3, and then L4, and then L5. Now your sacrums are all fused. There's 4 of those are fused. Then you got your coccyx. Now, your cervical and your lumbar vertebrae are the most susceptible to injury because they've got pretty much a 360 range of motion. But your thoracic is more protected because your posterior ribs are attached to each one of your thoracic, so they're harder to break and they're a lot more protected. Any questions? There's C1 through 7 in real life, what it looks like. Spinal cord inside the spinal canal. Again, not a whole lot of room there for swelling, blood, and errors. Or broken bone fragments that could cut the spinal cord. Not good. Any questions? There's the MRI of one. All right, your thorax, that's your rib cage. Your thoracic cavity is a body cavity. It is in the superior section of your thorax. So you've got your 11 ribs on the front, your 12 ribs on the back. As you can see, they're all put into T1 through T12. Any questions about the thorax? There's a good cartoon about the thorax. He protects the trees and speaks for them. They can't speak for themselves.
You're so close.
What?
You're so close.
The thorax. Little dude, lots of weird hair.
That's my favorite one right
All right, the abdomen. So the abdomen is divided into 4 quadrants: right upper, left upper, right lower, left lower. Again, that is on the patient's right side, the patient's left side. You will be expected to know all the solid organs in the abdomen and all the hallowed organs in the abdomen and which quadrant they go in and what their function is. And we will teach you that. Any questions? I'll throw you some cliff notes right now, though. Solid organs, when they rupture, you got to worry about people bleeding to death. Hollow organs don't cause you to bleed to death, but they're generally, because they have a lot to do with digestion, have a lot of bacteria in them, and they cause peritonitis, which can lead to sepsis, which can then lead to death. Just a lot slower, more painful. Any questions? There's your 4 quadrants. Any questions about the quadrants? All right, pelvis. This one's important. So the strongest bones in your body, the pelvis. You also got some pretty large arteries and veins that go right through the pelvis. So you got your descending aorta, which splits, goes into your femoral arteries. You got your femoral veins, which come together to form your inferior vena cava. The problem with the pelvis is it's hard to break your pelvis. It's really hard. You got to work really hard to do it, but it can be done. And if you break those plates, they're very sharp and they can cut one of those arteries or veins. Do that, you can bleed out and die very fast. That's why pelvic fractures are extremely serious. Any questions? All right, lower extremity, everybody knows the song, but the bones connected to the bones. So your pelvis, then the hip. The hip is not a bone, the hip is a joint. It's where the proximal femur goes into the pelvis. It's a ball joint. It's got good range of motion, 360 degrees. You got your femur, which then goes down to your knee. Your knee, again, is a joint, but it's a hinge joint. It doesn't have 360. It's not a ball joint like your hip is. Then divides into the fibula and the tibia, not tibia. Tibia is the one on the front here that everybody can feel. Fibula is the smaller one on the back. That goes down to the cartilage that forms the ankle. Then your tarsals and your metatarsals, which are the bones in your foots. Then the flanges, also known as toes. Any questions about the lower extremities? That brings us to the upper extremities. So you got your clavicle and your scapula come together. Your humerus goes inside. It's also a ball joint for the joint called the shoulder. Humerus goes down to the elbow, which is a hinge joint like the knee. Radius is the bone on the thumb side. Ulna is the bone on the pinky side. That goes into the cartilage that makes up your wrists and the metacarpals, which are the bones in your hands. Then your flanges are your fingers. Any questions? Questions, huh? Difference between ball joints and hinge joints. Ball joints are your shoulders and your hips. Hinge joints are your elbows and your knees, fingers and toes. Any questions? So when someone breaks their hip, there is no real thing called a hip fracture. It doesn't really exist. It's a proximal femur fracture. The head of the femur is still inside the pelvis. The top of the femur is floating free. Proximal femur fracture. Any questions on the functions of the musculoskeletal system? Now your muscles, you should have about 600 of them. They pull and contract and relax to provide movement for the body. You got three different types of muscle. You've got skeletal muscles, which are your voluntary muscles. If you want to move your arm around, you tell it, move my arm around. Then you got smooth muscles, which are involuntary. You don't have to think about those. They're run by your autonomic nervous system. Things like your esophagus, your intestines, your heart. But your heart's actually cardiac muscle, which is a separate one. It's a very special muscle because it can makes its own electricity, regulates its own electrical system, has its own blood supply. Kind of cool stuff. We'll go over that cardiac section after midterm. Any questions so far? There's that cardiac muscle. Any questions? Any questions? Any questions? All right, the respiratory system. We're going to get really good at learning this. Starts your nasal and oropharynx. Goes down through your epiglottis. Your epiglottis prevents food and water from going into your airways. Down to your trachea and your larynx. Breaks off into your bronchioles, which breaks down to your bronchioles. and eventually gets down to these little tiny air sacs called alveoli that only one red blood cell at a time can pass through. That's where they exchange carbon dioxide for oxygen. Then the expansion and relaxation of your chest so you can get air going in and out is run with the diaphragm and the intercostal muscle. We'll go into that in more detail. Any questions? I guess we're going to go over it now. All right. Ventilation is the process of moving air in and out of the body. So how does that work? So atmospheric pressure at sea level is 14.7 pounds per square inch. You lose about a half pound for every 1,000 feet of elevation. So up here, we're at 3,500 feet. So we're probably right around 12.8 to 13.2 pounds per square inch of atmospheric pressure. So when your diaphragm contracts and your intercostal muscles contracts, that expands the volume of your thorax, creates negative pressure. So then atmospheric pressure rushes in and equalizes the pressure inside your chest. That's how you inhale. Then when your diaphragm and your intercostal muscles relax, it creates greater than atmospheric pressure and the air rushes back out to the atmosphere. That's how you exhale. Now, it's also why people have a harder time the higher of elevations they get, because you don't have as much air pressure to breathe. So your respiratory system doesn't work as well the lower the atmospheric pressure is. Why a lot of athletes come up here to train and come up to high elevations to train, is then when they get back down to normal, then it feels like they got nothing but oxygen. Any questions? Diaphragm is a pretty cool muscle. It's one of the only muscles that has voluntary and involuntary control. So if you don't think about your diaphragm, it will still breathe 12 to 20 times a minute. It will contract and relax for ventilation. It's not you thinking about it. But if you want to take a deep breath, you can voluntarily contract it and do that. Or if you want to blow out birthday cake candles, you can take a deep breath and then you can force air out using your diaphragm. Pretty cool, huh? Now, another important thing to know about pediatrics is kids, especially little kids, they don't have any thoracic or intercostal muscles yet. They develop those later in life. Start getting around pre-puberty, puberty, around that era. And I can give you an example of that. So have anybody ever had the wind knocked out of them? You know, this doesn't happen as much as an adult. Still hurts as much, but not nearly as scary as when you're a kid. Because when you're a kid, getting the wind knocked out of you is diaphragmatic spasms. So you take a blunt force trauma and your diaphragm spasms, and so you can't take a breath. That's why they call it knock the wind out of you. Now, if you're an adult and you have a diaphragmatic spasm, you still have intercostal muscles. So it's kind of like, can't breathe, can't breathe, can't breathe, but you can, because you can still run your intercostal muscles. And what's the trick? Anybody teach you guys that as a kid? When you get the wind knocked out of you, how do you stop a diaphragmatic spasm? Yeah, put your hands up in the air, stretch out that diaphragm, and stop the spasm just by stretching it.
That would have been very helpful to know as it comes to health.
Yeah, I agree.
I actually know that because
every time I run, I gotta.
Yeah, your friends should have taught you that.
They're fake.
Drop them.
I learned that when I was in kindergarten. You fall off the monkey bar, it's like, oh, there, put your arms up, put your arms up. Put your arms up, like,
I think I almost
oh.
passed out on the cord. Or after swimming.
Any questions? Any questions about how to inhale? So if you're in a vacuum, you can't breathe. Don't ever get caught in a vacuum. That Dyson's a bad dude.
Dude, this freaking guy.
Any questions about exhalation? All right. Oh, now here's something we hope you really like. So, the way respiration works is the back of your head, the stem of your brain, you have your brain sense called the medulla oblongata. And it's watch the water boy should know all about it.
That's literally what I thought of instantly.
Mama said. alligators. Anyway, so when the carbon dioxide level in your blood reaches a certain point, your medulla oblongata, it triggers your diaphragm and your intercostal muscles take a breath to blow off the carbon dioxide. Then you got a backup system called a hypoxic drive, which is your secondary system. That's when you get too low. Hypoxia means low oxygen. Vocabulary word you have to know. Medulla oblongata, well, hypoxia, definitely even more than medulla oblongata.
Okay.
And where it's going to be important that you guys understand the carbon dioxide drive and hypoxic drive we get later into oxygen and stuff and therapies. So just keep that in the back of your head. And now here's something we hope you'll really like. Whoops. Watch that. Any questions about the inhalation exhalation process? There's a great picture of the carbon dioxide and oxygen exchange. So remember, when we breathe in, we take in oxygen, goes all the way down to the alveoli. Only one red blood cell at a time can pass through there. It changes out a carbon dioxide atom for an oxygen atom. Then when you exhale, it blows the carbon dioxide out. Any questions? Any questions about the brainstem, the medulla oblongata, your carbon dioxide system, and your hypoxic backup system? So the reason why that's important to know is if you have someone that's got a condition, which is millions of Americans have, called chronic obstructive pulmonary disease, most commonly emphysema, is they retain carbon dioxide because they don't have good gas exchange because their airways are all messed up and their alveoli are all messed up. They have lung disease. So their carbon dioxide level always runs high. So they're always on the backup system, which is hypoxic. So if you leave them on too high of a concentration of oxygen for too many hours, they'll stop breathing. That's very bad. What do you do if they stop breathing? Nobody knows. Ventilate them with a BVM. Oh. Any questions? All right. What does normal breathing look like? Everybody in this room is breathing normally. Normal rate and depth, no noises. Color's good. Equal rise and fall of the chest. They're able to speak whole sentences without having to take a breath. Those are normal characteristics of breathing. Any questions? Those are your general normal rates for adult children and little ones. Any questions? Any questions? Any questions? All right, irregular breathing. People start turning blue. That means they're not breathing adequately. It's called cyanosis. It's a sign of hypoxia, which is low oxygen levels. If they're struggling to breathe, they're laboring. You can see accessory muscles being used just to try to get as much chest expansion as possible in their clavicles and their neck. If they're tripoding, leaning forward, trying to get as much gravity to help expand the chest as possible. Rapid respiratory rate, cool slamming skin. They can only speak one or two words without having to take a breath. That's all inadequate breathing. Making sounds like wheezes, stridors, things like that, which we'll go over in detail in respiratory emergencies, are all signs of inadequate breathing. Any questions? All right, some big differences between kids and adults. Anybody watching cartoons, Snoopy cartoons, Peanuts? Those are the most anatomically correct drawings I've ever seen. Kids have giant heads in comparison to the rest of their body. And the problem is not only do they have giant heads, but they have very weak airways. Their tracheas and their cranial cartilage has not calcified yet. So it's very soft and it's very weak and it's also very anterior. So when kids go unconscious or they're lying flat, it's very easy to shut their airway off because their head's so big, their occipital area is so big, it pushes it forward and it's already soft and interior. So it's just like pinching a straw shut. So that's a big deal in kids. So you never want to lie a kid on their back. If you do, you want to put padding under their shoulders so it equalizes and levels out that airway. Make sense? Kids also have a proportionally larger tongue because their head's so much bigger. So that's also the tongue's one of the biggest airway obstructions if you're unconscious. And they generally don't have intercostal muscles either. So they only have diaphragm to breathe with, as we discussed earlier. Any questions? Another big problem that is for like little ones, like under 2 years old, is also they can't get the airway pressures to cough out gook. So if they get things that's just a common cold for us, like RSV, flu, it can be deadly in them because they can't get the airway pressures because they don't have the calcification. And they can't take a big deep breath and go hack and hack all that zliggies out. So it can be fatal for kids.
Put something under their shoulders, is that like for when you're trying to get like oxygen?
Yeah, or you're trying to ventilate them. They're unresponsive. That's going to put the airway, it's setting yourself up for success. Remember, we talked
Right.
about preparation is everything. Because, yeah, if you're lying on the flat of their back with their head
They're
built
close
forward
to-
and the airway's kicked like this,
Yeah.
you're not going to get airflow. Questions? All right. The circulatory system, you're expected to understand blood flow from the cells all the way through and back. I'm going to walk you through it right now. So I want everyone to pretend they're a little red blood cell. And you've just changed the oxygen atom for a carbon dioxide atom at a cellular level. So you're going to take a trip back through a vein. The veins are going to come together to the vena cava. Now, if it's below the heart, it's the inferior vena cava. If you're above the heart, it's the superior vena cava. Both the vena cavas, superior and inferior, come together and they go into the right atrium. That's the first chamber of your heart. You're going to go through the right atrium to the tricuspid valve. And you're going to go through the tricuspid valve into the right ventricle. Right ventricle pumps blood to the lungs to get more oxygen. So you're going to go through the pulmonary valve into the pulmonary artery. Now, the cool thing about the pulmonary artery is it's the only, so all arteries carry blood away from the heart. All veins bring blood to the heart. Unique thing about the pulmonary artery, it is the only artery in your body that carries deoxygenated blood because it's taking it from the right ventricle to the lungs. You're going to get into the lungs. You're going to change that carbon dioxide atom for an oxygen atom. Then you're going to come back through the pulmonary vein. Now, the pulmonary vein is the only vein in the body that carries oxygenated blood. All the rest of the veins carry deoxygenated blood to the right atrium. So the pulmonary vein goes to the left atrium with the oxygenated blood. That's going to dump into the left atrium. Then it's going to go through the mitral valve to the left ventricle. And it's going to go out the left ventricle through the aortic valve to the aorta, which is the largest artery in the body, which then divides up to the smaller arteries, then down in your capillaries, so it gets right back to the cell where you change that oxygen atom for carbon dioxide atom, and the whole process starts over again. Any questions? I know it sounds like a lot. Once you get it down, it's not that bad. And we'll go over the arteries of the heart later on. You don't got to worry about that right now. Yeah, just in case I didn't explain it well enough, this guy explains it way better than me. I like this guy way better. Any questions? No questions, huh? Alrighty then. On to the next one. Same video. And we'll go over the electrical conduction of the heart later. Pretty cool. And we'll go over it in detail, but that'll be after midterm, which will be here before you know it. So there's your average heart rates where they should pretty much be. What do you think they call it if our heart rate is below 60? Your medical terminology knowledge. Rating heart rate. And then if it's over 100 beats a minute, we call it tachycardia. Very good. Any questions? There's your major arteries and veins you should be familiar with. Remember, the superior vena cava is above the heart. It drains into the right atrium. The inferior vena cava from below the heart, it goes up to the right atrium. Questions. All right, 4 components of blood. What makes blood? Plasma is the liquid. Red blood cells carry your oxygen and nutrients. White blood cells are fight infections. And then platelets, that's the damage crew. If something's going wrong, they're the ones that rebuild the vessel walls, stop you from bleeding to death. Any questions? All right. No questions. All right, physiology of the cardiovascular system. So when your aortic valve opens up, your left ventricle pumps, it sends a wave of blood out. So you guys have been practicing vital signs the first 2 nights. When you're feeling for a pulse, what you're doing is you're gently pressing an artery up against a rigid surface so you can feel that wave of blood flowing through from the aortic valve when the left ventricle contracts. But if you push too hard, you won't feel it. Hard enough, you won't feel it. You won't find it if you don't have a rigid surface to put it against. So we check for carotid pulse on adults because you're pressing up against the cartilage in the throat. The reason why we check for brachial pulses in babies is because, again, they don't have that cartilage yet. They haven't calcified. That's why you can't feel a pulse. That's why you got to go against the humerus to find a pulse in a baby. Make sense? All right. Any questions about pulses? So blood pressure. I know you guys have already learned this, but so your systolic pressure, when we first start hearing the pulse in the stethoscope, when the blood pressure cuff, that is when the left ventricle is contracting. That's the pressure exerted when the left ventricle contracts. The diastolic, when we stop hearing the pulse, the stethoscope, that is when the left ventricle is at rest. That's why it's called diastolic. It's the sitting pressure, the resting pressure. The systolic is the forced pressure, contracts. Diastolic is the rest. Questions? All right. Perfusion is a vocabulary word you must know. Perfusion means adequate circulation, getting oxygen and nutrients to every distal cell in the body. Distal means the farthest out cells. The definition of shock is inadequate perfusion. Not enough perfusion. The cells are not getting oxygen and nutrients. That's what shock is. Any questions? Anybody nervous? Just kidding. All right, nervous system's broken up into two systems. Somatic and the autonomic. And then the autonomic's broken up into two systems. Your somatic nervous system is your voluntary actions, telling your leg to move, kicking the football if Lucy doesn't pull it away, picking your nose. Those are all voluntary actions. That's your somatic nervous system. Now, your autonomic nervous system, that's the autopilot, things that you don't want to think about, telling your heart to beat, telling your diaphragm to contract, telling your muscles to digest food in your digestive system, all the things you don't have to worry about. And then your autonomic's broken up into two separate sections called the sympathetic and the parasympathetic. Now, you guys have already learned about the sympathetic, you just don't know it yet. That's your fight or flight. We talked about the saber-toothed tiger and the caveman. Caveman has that saber-toothed tiger and jumps out. He's got two choices. He can run for his life or he can fight for his life. Either way, he needs the same things: dilated pupils, dilated airways, increased blood pressure, increased pulse, dilated pupils, decrease or releasing of the glycogen in the liver, increasing your glucose and your blood sugar, contraction of the muscles. That's all your sympathetic response. Also the response to stress. Your parasympathetic is all your vegetative functions. That's your digestive, your heartbeat, respiratory. Those are the two sections of your autonomic nervous system. Any questions? All right, then how do the nervous system work? There's two things. You got a central nervous system and a peripheral nervous system. The central nervous system is real easy. It's your brain, your brainstem, and your spinal cord. That is your central nervous system. All the nerves that come off of your spinal cord to the rest of your body is your peripheral nervous system. Any questions? There's your peripheral nervous system. All right. In your peripheral system, you got sensory nerves and motor nerves. Sensory nerves sense things, send it to your brain so your brain can make a choice. Your motor nerves is when your brain tells your somatic nervous system to do something. Move the leg, move the arms, move the fingers. Then you have what's called a reflex artery. In case you do something really stupid, like stick your hand into a burning flame, it pulls back. Doesn't want to wait for your nerves to all the way to your brain to tell it to do that. That's called the sensory artery or reflex artery. And then that goes straight back. I think I got a picture of it. Maybe not. Any questions? Reflex arc, that's what it's called. Back in biblical times, they called it Noah's Ark. Not really. Don't write that down. All right. Skin is the largest organ in the body. Very important. Regulates your body temperature. Protects you from viruses and bacteria. Has most of your sensory nerves in it, so you can touch and feel. Sends all that information to the brain. That's what your skin looks like from the side under a microscope. Any questions about skin? Oh boy, the endocrine system. So we have one whole chapter we're going to do after midterms about the endocrine system. So your endocrine system is what regulates and runs your body. 7 glands that release hormones that are the regulatory effects. The most important one you need to know as EMTs is the pancreas, which releases insulin. Again, we're going to spend an entire chapter on that. Any questions? Excuse me. There's the 7 glands. Any questions on the endocrine system? There's the digestive system from the beginning to the end. Starts the mouth, you put food or water in your mouth. Salivatory glands help break it down. Goes through your oropharynx to your esophagus, dumps into your stomach where digestive enzymes, bacteria, and acids break it down. Pancreas puts some more digestive enzymes along with your liver and your bile ducts, breaks it down into mush, sends it into your small intestine, where the water and the nutrients are absorbed from your small intestine to your bloodstream. Then it's put into your large intestine, what it doesn't use. If it's something that's contaminated, your appendix will release some stuff to help it out, to not kill you. And then what you don't use from the large intestine poops out through your rectum. That's the digestive system. Questions? All right. Then we got the urinary system, where your kidneys run as a giant filter, kind of like your liver, reabsorbing sodium and water, pulling water out of your system, run it down your ureter, stores it in the bladder till the bladder gets full, then it voids it out through the ureter. Any questions? All righty. Then we got the male reproductive system, which we'll go into more detail about later, along with the female. Should have gotten that in 8th grade. Any questions? All right. Things to take home. Systole and diastole of blood pressure. Make sure you understand it. We're going to get through chapter 7 today. Any questions about blood pressure readings? That's okay. We're going to get caught up when we get into like soft tissue injuries, traumas, cardiology, and respiratory. It's going to slow us down. So it's good to be a little bit ahead. Any questions about normal circulation in adults? What perfusion means versus hypoperfusion, which is shock? No question. Those are some of the things right there that could cause shock: loss of blood loss, heart's not pumping well enough, your vessels fail. All those things can cause inadequate perfusion, but we're going to do a whole chapter on shock here in the very near future. There's the mean arterial pressure, average pressure chart. You have to know it for the test. Just kidding, you don't. Any questions? So blood carries nutrients and oxygen, removes waste, gives you clotting, also helps fight infections. Blood is extremely important. You cannot live without it. questions? Sympathetic nervous system is your fight or flight. Fight or fight, fight or flight. Sympathetic nervous system. There's a really good chart on it.
I'll be honest, I can't read a single word that's on there.
Yes, but you can go to the website and look it up and pull it up on a bigger screen.
No, not at all.
Any questions? Actually, I really like that drawing. Well done. Again, your parasympathetic is your vegetative functions. Those two balance each other out. That's your autonomic nervous system. And your baroreceptors are part of that, which also helps regulate your blood pressure. Any questions? Central nervous system is your brain and spinal cord. Your peripheral nervous system is all the nerves that come off of your spinal cord. Any questions? Brainstem is also known as medulla oblongata, which is Latin for brainstem. Any questions? So your brain's floating inside cerebral spinal fluid. It helps protect your brain, gives a little bit of a cushion when you get smacked upside the head. Also goes down your spinal canal. Oxygenated blood goes to your brain through the carotid arteries to the circle of Willis. Deoxygenated blood comes down out of your brain through your jugular veins to your superior vena cava, to your right atrium. Any questions? Any questions on your central nervous system? Ta-da! Any questions on your peripheral nervous system, dividing up your somatic and your autonomic, then divides into the sympathetic and the parasympathetic. And your somatic divides into your sensory and your motor nerves. Any questions? Any questions? Any questions? Going once, going twice, gone. Remember, your skin is the largest organ in your body. It protects you from viruses and bacterias, regulates your body temperature, has all your sensory nerve endings. Any questions? Important stuff. Already went over that. Any questions? Tired of hearing me say that?
I'm gonna start keeping a tally of how many times you say it.
Shit. Could make it a drinking game. No, nobody'd make it out of the end of the night. I did not just endorse drinking. Any questions about the GI tract in your digestive system? Again, really good drawings. I really like those. You all good? See, I didn't say any questions. You all good? Your four quadrants. Make sure you know your solid organs and your hollow organs. You all good?
Any questions? Yeah, I think the questions were better. Y'all good?
All good doesn't work? Okay. Important to know your hallowed organs. If you're ever chased by a witch, they can't go over hallowed organs. Oh wait, that's ground. I'm sorry. Again, very good drawings. I really like them. Review of the digestive system again. How does it break down? Enzymes in your saliva, your stomach, your liver, your pancreas. Puts it all into a nice fine mesh for your small intestine to absorb the nutrients and the water out. Put it into your system. Any questions? Oh, the lymphatic system. That's a good thing to know too. Supports your circulatory and your immune system. Through your lymph vessels and your lymphatic system and your lymph nodes. All right. That's the circle of life, the endocrine system. Kind of cool. Your endocrine gland gets stimulated, whichever one of the 7 it is. It secretes the hormone, which interacts with the targeted tissue, which gets the effect, the desired effect that it was trying to get. Any questions? Pretty cool. How does that work with your adrenal gland? Tiger jumps out of the bushes. Rawr! That stimulates your adrenal gland, then secretes adrenaline, then dilates your pupils, increases your heart rate, increases your bronchus, so you can run for your life or fight for your life. Make sense? All right. That's where all the endocrine glands are in your body. Urinary system. Make sure you understand it. Good news is none of this chapter is going to be on exam 1 on Monday. Only the first 5 chapters.
Rather this one be on it than the freaking.
But the laws and
Right. I could do laws. I can't do prefixes. That screw me over.
Oh no, that's easy.
No, I'd rather the human body be
You
on it.
explained it pretty good. I think I got.
Hey, did you hear that? I explained it pretty good. So
I
there.
would.
Everyone learns differently. I'm split.
Any questions about the endocrine system? Well, this is the genitalia. Just review. We've already been there. Just review. Any questions? Life support chain. All right, here we go. Again, every cell in your body requires perfusion, even the most distal cells. If they have inadequate perfusion, that is called shock. If you're in shock too long, the cells will die. They cannot survive without oxygen and glucose. If you don't have enough oxygen or enough glucose, your cells will eat themselves to create enough energy to try to survive. They will literally eat each other. Any questions? We call those Donner cells. Donner Party, they all ate each other.
I didn't think you said daughter. I thought you said daughter.
Oh, I
Daughter?
heard daughter too. That's,
Wow.
yeah, you said Donner?
Said Donner.
Donner with
Donner.
N.
Donnor. Donner.
It sounded
Or maybe it
like
was
daughter
ER.
over here. That's
I
why I
heard
heard
daughter.
All right. Pathophysiology is how the physiological process is affected by disease. Respiratory, again, when you can't breathe or you don't get enough oxygen, it'll become hypoxia. Then your cells die if you don't reverse it. But ventilating and oxygen is so important. Hypercapnia is too much CO2. Any questions? So what impairs ventilations? Well, if your airway's blocked or closed, you're not going to breathe. If your diaphragm or intercostal muscles aren't working, you're not going to breathe. If your airways are obstructed, you're not going to breathe. Any questions? If your other factors, you're in a room with no oxygen, not going to get oxygen exchange. If you're buried alive, you will not get oxygen exchange. If you're underwater, you will not get oxygen exchange.
What lays on you?
You will not get oxygen. Higher the altitude, the less pressure, the less air movement, less gas exchange across the alveoli. Any questions? Ooh, ventilation quotient ratio. How it measures how effectively gas is moving through the lungs. Oxygen for carbon dioxide exchange. Any questions? Just review. Make sure you know it. Gotta have oxygen. Gotta have glucose. Bad things happen. Shock. The definition of shock is inadequate perfusion. And we got a whole chapter to go to the different types and different stages of shock. None of those are good things. Any questions? So what happens when you go into shock? You don't have proper amounts of oxygen and glucose, cells die. If it goes too long, it's irreversible. Those cells never come back. Cell death leads to organ death. Organ death leads to your death. Any questions? Which of the following is in the retroperitoneal space? The peritoneum is the sac that holds all of your organs. So if it's retroperitoneal, where would that be? So what two organs are behind the rest of the abdomen? Kidneys. All right. Cartilaginous tip of the sternum is called the?
These, xiphoid proteins. Yeah.
Very good. So you guys must take in CPR. You know about your xiphoid process. A person with bilateral femur fractures has broken what? You guys are good. What's the most prominent landmark on the anterior surface of the neck?
Thyroid column.
Sure it's not B? It's C. What else do they call it? Yeah, very good. Who makes insulin? Yep. All right.
Okay.
So chapter 7 I'm not a big fan of. I mean, it's pretty much obvious, so we're just gonna blow through it, and then we'll go to break. That'll put us, what, 2 chapters ahead? It'll give us a little cushion in class. What?
I'm sorry.
We
I
just
had
had to
to
talk
look
about
at
this
for
2
2
chapters.
Yeah,
I have
well,
to go.
this slideshow, I mean, to me, this is just so obvious. So go ahead and go. It's not important. So this is what happens. You start as a baby, you become a toddler, then you become a small child, then you become a child, and then an adolescent, then you become a young adult, then you become a middle-aged adult, then you become elderly, then you die, unless something happens in between that. That's chapter 7. So neonates are the first 30 days. They don't even list neonates, which also drives me crazy. And then from 1 month to a year is an infant. But we just like left neonates out altogether. And they develop at a startling rate. My God, look how fast that kid's growing. Does anyone have any questions about infants? We generally don't even take vital signs on them. We don't. And we check their heart rate and their respirations. We don't generally check. We generally don't check their blood pressure. That's the average weight. They gain about 30 grams a day. And by the end of the first year, their weight should triple. Questions? So the pulmonary system, which we already went over, is very, very fragile. They have very soft rib cages. They cannot create pulmonary pressures. Their diaphragm is the only way to breathe. Their airways are very soft in the interior. They got a giant head that they go unresponsive. It's just bad. Fontanelles. So the fontanelles are the pieces of your skull. Same thing. They haven't got the calcified together yet, so they're floating. I can tell a dehydrated infant right when I walk in the door for my doorway impression because they'll have a dent in their head because the fontanelles will actually collapse from the lack of fluid. Something that you might get tested on. There's the fontanelles. All right, toddlers and preschoolers. This is where they start getting into trouble. Start being able to walk, start being able to talk. Starting to get attitude like that little one. Any questions? Weight gain levels off. They don't triple in size like they did as a baby. Start getting their own immune system. Start growing teeth. Start learning how to use the restroom. Big advances. Any questions? Start mastering languages, understand differences between boys and girls, learn how to play games. Any questions? And then school age. Vital signs really level out. They start looking like little adults. Permanent teeth comes in. Brain starts working on both sides. Still no frontal lobe though. Start getting conventional reasoning. Any questions? Start understanding consequences of actions. Maybe.
School age child who understands the consequences for their
I've met a few.
very few. Most of them just act on it.
So do a lot of adults.
Yeah.
Any questions about school age children? That brings us to adolescence. Nothing but trouble. Any questions about adolescents? Least likely to burn to death in a structure fire statistic. They always seem to get out. Kids and elderly people don't get out. Adolescents, they're gone. Any questions? Girls develop faster than boys. Any questions? Antisocial behavior. Nothing but trouble. Any questions?
That's how you think it's
Yep. Nothing but trouble. I still think I'm a teenager until I look in the mirror. Early adults. Any questions? It is a long time span. It goes by very quickly.
I'm aware. Yesterday I was 17, I swear to God.
I still am maturity wise.
You're younger than that, mature.
Probably closer to 13. Any questions about the physiological changes with early adults? Middle age. Any questions? I have really nothing to add to any of these slides. It's common sense.
Yeah. Hey, but that's not that common. So you can't say anything.
It's
They pay me to teach it.
They pay me to teach it. They pay for this book.
Who? What's the leading risk factor of cancer?
Okay.
No. Good guess though.
Thank you.
Age. The longer you're alive, the better the chance of getting cancer. Any questions? Y'all good? You gonna make it through? You can see light at the end of the tunnel. Physiosocial changes. Any questions? Geriatrics. Apparently you're nobody from 60 to 61.
That's your midlife crisis.
I guess so. Actually, in reality, your midlife crisis stage just comes as a, what do they call it? Middle adult.
No.
Because you're midlife. Once you're over 60, that's late life. Life expectancy keeps going up and up and up as medical technology and living conditions keep improving. Questions. People used to only lived about 35 or 40. Now they're living into their 80s. Some people are living over 100. Some people can live up to 120 years. Any questions? What's that?
So with the price of stuff anymore, I don't want to live to 100.
I was like, I not want to live to 120. That's what I was gonna say. I hope I don't need that much. Miserable, like taking out 87.
Big problems when you get old. Health conditions, medical conditions, got to start taking more medications. You don't heal quickly. Things just don't, they say getting old is hell. Any questions? Start losing your sensory nerve perceptions. Get burned in hot tubs and heated blankets. Need glasses, hearing aids. Any questions? Most people retain high brain function until they're about 5 years from being dead. Any questions? All right. Oh, no test questions. I don't think we're gonna start chapter 8. Chapter 8's a pretty big chapter, I think. Oh, lifting, yeah, we're not gonna do that.
Why are you laughing? Nothing at all.
All right. Well, you guys go to break, except for Bainbridge. You can come meet me and we can talk about this. I'll see you guys back at 8 o'clock.
Okay, like 12
Brian, are
minutes
we
from now.
gonna learn